All right. Abstract 101, welcome all to our wonderful experience of fun this afternoon at noon. Appreciate those of you willing to give us a little of your time. Hopefully we will be helpful. I'm Jen Funderburk. I'm here with some other amazing people who are gonna kind of help me go through this wonderful slideshow. Do people see the slideshow?
We do.
Yes, thank you. I'm not going to look at Maria every time. She's so quick in making her face clearly communicate what's going on. Okay. So I am the co-chair of the Research and Evaluation Committee for CFHA. And we were thinking this might be a valuable webinar for our members. And we asked the planning committee chairs to join us in this effort to kind of give this wonderful webinar. And I just want to thank them for being willing. They're very busy people. And I was a co-chair of a conference a couple of years ago, and it is a big ask. So I was shocked when they agreed and very thankful that they were willing to give us their time. And I'm just going to go through and let us all just briefly say our names and which committee we're either from. So as I said, I'm Jen Funderburk, and I'm from the Research and Evaluation Committee within CFHA, and we work to try to helping people kind of improve their ability to do program evaluations, quality improvement, and research on the topic of integrated care. Jeff, you want to introduce yourself real quick?
I'm Jeff Goodie. I just do what Jen tells me to do. I'm on the same committee.
Okay. And Maria?
Hi, I'm Maria Montanez. I am one of the co-chairs for the CFHA San Antonio Conference. Happy to be here.
And Clarissa, you're next in my little boxes.
Sure. Hi, everyone. My name is Clarissa Aguilar. I am also a co-chair for the 2024 annual conference in San Antonio. We're very excited. Welcome, everyone.
I'm looking forward to the heat. It's going to be great.
Oh, you say that now. You say that now. That is a terrible thing to say. Well, you're in upstate New York, so maybe.
I know.
Yajaira, Johnson-Esparza. I'm also one of the co-chairs at UT Health San Antonio. I work with both Clarissa and Maria very closely here in San Antonio. And both Clarissa and I are former PCBH SIG co-chairs also, and we're still members of the PCBH SIG.
Great. And we're just very excited to have you here, everyone here today. What are we going to do? Well, we're going to first cover this important question of why you might consider submitting an abstract to a conference. We're going to focus our example on CFHA, but to be honest, a lot of this material, once I went through it, you can use this for any organization conference. So I really encourage you to think about it. Anytime you're submitting to a conference, you can go back to it and look at it, and it might be helpful. We're going to review the call for abstracts, review the call for research and evaluation track abstracts, and then we're going to try to give you some tidbits for success, and we'll open it up to questions and answers. You might be asking yourself, boy, you know, those abstracts are due March 15th. Is it possible to actually do all this? And I will argue with you that on a regular basis, about 75% of the people who submit abstracts are doing it about the day before or maybe 2 days before. I would love to say that we're all more prepared, but 75% of those abstracts are submitted in the 24 hours before. Jackie always would love it if it was earlier, but that's not typically how it happens. So yes, you can. And we hope that you consider it. And hopefully this will give you some helpful experience, helpful knowledge to apply to it. All right, I'm going to turn it over to our conference co-chairs to explain to us maybe why you might want to submit an abstract to a conference, and particularly our upcoming one.
Good morning, everybody. So why do you want to submit an abstract to the conference? Well, we may be very biased, but we're very excited that the next conference is in San Antonio, and we think San Antonio is a wonderful place to visit. In addition to that, you have an opportunity to share your amazing innovation work and what you have been doing. We need to learn more about what people are doing at their own site so that we can get inspired and feel invigorated to do stuff in our own sites. You get to meet other people who are interested in similar areas. Networking is very important in what we do, and CFHA conference is a wonderful place to do that. On a more importance to us, it improves our resume and our CV. That's going to open doors for promotions, and that can open the doors for other opportunities as well in our career. And like it was said before, yes, you can write an abstract quickly if you need to. And I'm glad to know that I'm not the only one that perhaps submits them 24 hours before they're due. Next slide, please.
Glad to make everyone feel better.
Yes. So whenever you are considering applying or submitting a proposal to a conference, the first step that you should do is go and check that conference's theme. It gives you an idea on what they're focusing on and what the organization wants to highlight in that particular conference. Our first conference was held in 1995, so we're very excited about celebrating the 30th anniversary of CFHA this year. And a lot has happened since then. CFHA has remained committed to integrated care, and it has remained its guiding force. But this year's conference theme is going to highlight that even though circumstances may have shifted through different lived experiences in the past 30 years, healthcare has remained committed to our efforts of integration. And so the theme for this year's conference is 30 years of integration, innovating in the pursuit of healing. Next slide.
Okay, so thank you, Maria, for that introduction. So we are very interested in hearing from you. And what I'll add to what Maria has said is that we really feel like this conference, well, we want it to really highlight the efforts over the last 30 years. So if you have, as Maria said, that lived experience of having worked on developing integrated care in your setting, we want to hear about it. And even though we are in Texas, we don't want to shy away from any difficult topics like women's health or women's reproductive health, issues that relate to the challenges of gender affirming care and the evolution of those efforts today, especially in our state. But we are very interested to hear about what's happening beyond our state as well. We want to hear about these challenging things like the impact of joint efforts from law enforcement and community health agencies on gun violence. We all are living the crisis of pediatric mental health services and children's health services. So if you have anything related to that, please bring it. We also want to hear about things helping our teams and patients address system inequities, championing diversified opinions, equitable care and access, and healthcare for all. So we actually believe that integration is the answer to many of these issues. So our hope is that maybe on some of those issues, all those issues, any of those issues, you have done like a quality improvement project to kind of figure out how to improve a workflow process in your clinic. You would be more, we'd be really happy to hear the results of that. What about a program evaluation project that you've done on how you are collecting PHQ-9s in your particular clinic? We would love to hear about some of that. If you are doing some specific kind of research on integrated care, maybe with different team members, a particular clinical approach, a particular clinical skill that you would like to teach on a particular specific patient population, that would be wonderful. I happen to work in a clinic that works with severe mental illness. So I know we are always looking for tips and tricks for how to help folks manage their chronic medical conditions. And then we know that many of us provide supervision and training. So if there's any tips, tricks, skills, ideas you have related to that, please feel free to add some of these ideas into our conference. I see that Jeff's hand is up.
So just a quick question. If my research or what I want to submit doesn't fit neatly into the theme, should I still submit for the conference?
Very good question. Yes, you should. Yes, you should. as I was saying earlier, we are really hoping to have this diversity and a wide scope of interests. So while our theme is focused on, this 30 years of innovation and integration and tackling some difficult issues, by all means, if it does not fit that mold, that does not exclude you. We want to hear from you, and we definitely want to include everybody's work. We know that we can't do the work or push our work forward without everybody contributing. So great question. Thank you for that. Okay, next slide, please. Okay, so what we are doing is this is actually the new platform that everybody's been talking about, and Jackie was mentioning earlier. If you logged on a little bit late, she would love some feedback about it. If you go to the integratedcareconference.com, it'll take you to a little link that says call for proposals, and then you go to, it'll take you here to the SWOGO, I don't know if I'm saying that, SWOGO.com, and if you click on submission template, it will help outline all the things that you might need. And there are quite a few things that you might need, like learning objectives, which we're going to get into in a minute. But oh, there it is. Thank you, Yajaira. She kind of put this in the link in the chat box if y'all need it. But it's a really nice guide. There's a template there that can take you through everything that you might need. But those are the first few steps that you would need to get started. And I think now we're going to move into.
Oh, can I just make a comment about that? The nice thing about the template is it's downloadable. So if you don't like working in an online portal, eventually what you'll be asked to do for this particular conference is enter that information into an online system, which basically means there's boxes and you have to fill out all of that information. I find I'm old maybe, and I like to download the template, kind of prepare it, and then I go to the online portal and I fill it all in, and I can copy paste into each box. Some people may not like that, and you can obviously go straight into the portal and start entering it. It's just, for me at least, I like to pre-prep it and spell check it, things that I can't do when I'm in the online portal. Okay. All right.
Did I miss step 3?
I think we skipped slide 6.
Oh no, that would be good. Sorry about that. That was probably a technical issue on my part. So just returning before you get to the template.
Okay, so before you get to that template, you should think about what kind of abstract you would like to submit. Whether this would be a presentation that is for an oral discussion, which can be 30 to 60 minutes. We definitely would prefer and like presentations that are interactive. There's a lot of data in science that tells us that if things are interactive, we're more likely to retain that information and also use that information in our settings. So if you can make an oral presentation that has some kind of interactive element, that would be great. Those presentations are limited in the number that are allowed per year. The next kind of abstract you could submit for is a poster presentation, and posters are less competitive, but a great place to begin. I think most of us probably got our research first steps started on poster submissions, but I love poster submissions because it really kind of can channel and bring together all this work and information that you're doing into a visual format. And so if you have different options for different information to provide, you can definitely present it in a poster presentation. And then the other thing that we'll be discussing today is if you would like to submit an abstract specifically for the research and evaluation track, which is really designed to provide this technical training, help people equip attendees with knowledge and skills for how to do particular research studies, and also how to evaluate real-world healthcare work. So we are going to go into more details about all those things, but those are kind of in general the 3 different kinds of abstracts. I think there was.
Yep.
Okay. I think that's good.
And just for people to know, if you've never submitted something like this before, a lot of times you can choose an oral presentation or a poster, and you'll be asked that. So there may be times where you're like, I would prefer to do it orally in a slot, but if I'm not accepted for that, I'd be okay with creating a poster instead. And so you'll be asked in that online portal to kind of indicate whether you prefer that or not. So an example of times when you may not prefer that, last year I put in a presentation where I was working with some colleagues of mine who were teaching the elements of brief CBT for insomnia. It was a very 60-minute overview of what brief CBT for insomnia consisted of. It was a very clinically oriented presentation. That didn't really translate very well into a poster. And so I said no to that. I said I could only do it as an oral or not at all because it wasn't really going to be effective as a poster. Whereas other things may translate very nicely to the written word, and it would just be displayed in a poster and you'd stand next to it and help people understand it.
Yes, and then one thing that I did want to say is that there are several kinds of like categories for the posters. So it could be a research, a program evaluation, as we've talked about, the QI. There's also a conceptual poster category, which is early stage development or a proposal for a new idea, model, or theory related to integrated care, and also a policy poster category. And then there's also a place where you can identify other in case your poster information and data doesn't fit into one of those categories.
Thanks, Clarissa. And I apologize. It was my fault that we skipped step 3.
Okay.
So just to review, we have step 1 is why you should submit. Step 2, if we go back in time here, let's see if can I go back? Step 2 is kind of, do you have something interesting to present? And then step 3 is choosing what type of thing do you think you want to use your interesting thing, your interesting program or project or thing to present innovation. And step 4, if you want, is to check out what you're going to be asked to provide to the organization when you submit this abstract. And that submission template is very handy. So moving forward to drafting your abstract.
All right. I think abstracts can be quite daunting, especially when we haven't done these in the past. I remember when I was first told to write an abstract in grad school, I felt like I was writing a dissertation. And I think I actually might have written a long abstract until my advisor slapped my hand and said, don't do that again, in a very kind way. But it can be a very daunting thing. And I think what we're trying to do is make it less daunting for everybody here. And again, like Jen said, this is great for any kind of conference. The typical format you want to follow when you are drafting your abstract is laid out for you right here. The first thing you always want to do with an abstract is you really have to say what the issue is. What's the problem? What is it that your abstract or your project, your study is going to be addressing? What's that gap in the literature that's out there? And let's talk about the evidence that supports this need for this abstract. This is your opportunity to start making the case and saying something like IPC care is lacking this one thing, whatever that might be, right? So this is going to be that hook, I think. I think this is a great way to think about it. It's the hook. Talking about why you're presenting this information will also help your audience. It will pull your audience. Many of us I think all of us, I don't know, when we go to conferences, the abstracts we're looking at are really determine where we end up going in the conference. And I think personally, I look at the title, right? But I also look at the first few sentences. And if those first few sentences do not make an appeal, then I might go to another event. Not an event, I'm still at the conference, another presentation, for instance. So you really want to make sure that you are telling your audience why this is going to be a very important talk for them to attend. If you have any data, whether it's satisfaction numbers, patient outcomes, whatever that data might look like, make sure you share that in your abstract. This is key. Many times we want to know what you have found to see whether it is a worthwhile presentation for us to attend. So make sure you're sharing that and be very specific about about it by sharing the basic numbers, by sharing those results. And this could be as simple as we collected data from a total of 25 patients. This was the age of the patients that we looked at, and the results showed that this program had high satisfaction levels. 97% of people said that they would do this again. Whatever that data might look like, you want to also make sure that you're highlighting this. And I would say this is really the meat of your presentation, right? People want to know, was this a good program eval or a good project you started? So this is going to be that meat. You want people to come for that. And importantly, in an abstract, you want to let people know what will be happening during that presentation. Will there be a panel? And this can be as simple as saying, we will hold a panel with experts across in the field who will talk about X, Y, and Z. You want to, whether you're going to present results followed by a Q&A, that's always a big thing when you can have some kind of Q&A and make sure that you are allowing for that time because your attendees will want that opportunity. Is it going to be interactive? Some people see that word and they shy away from those presentations, but I would say if it's going to be interactive, include it on there because it is a great way to engage your audience. Let them know whether you're going to show videos and demonstrate some skills to them. Like Jen's presentation last year, it was a heavily attended presentation and the abstract really explained what was going to happen. People knew they were going to go in and get some very tangible skills to go out and implement when they work with patients with insomnia. So you want to be able to draw that kind of attention as well. Clarissa, I think, mentioned the importance of objectives. And I don't think I saw a bullet around objectives, but objectives are really important. I think one of the audience members said, I had no idea how to write objectives. And then they just kind of got bombarded with this idea of objectives. Objectives are really important, especially at a conference like CFHA, where many of us are trying to get continuing ed credits. Make sure that you have some well-written objectives. There are some great resources out there looking at taxonomies that allow you to develop objectives that are going to really allow you to write objectives that are specific, measurable, observable. These are the kind of objectives you want to be able to write. So for instance, saying something like attendees will be able to describe 3 essential elements of IPC, for instance, versus attendees will understand IPC. Very different kinds of objectives. So make sure that when you are writing your objectives, you are looking at what are some standards for writing effective learning objectives. And again, there's a lot of resources out there and like some learning taxonomies that I think can be helpful as you're writing some of this. Okay, next step, please. Or next slide. All right, and Clarissa went over some of this already, but think about whether you could submit a presentation that is in line with the research and evaluation track. Clarissa mentioned a little bit about what this track really seeks out, and there are many things that can be offered through this track, and that's technical training on planning and conducting rigorous research. So if you have some of that, we want you to be able to submit abstracts that will tap into this. Any QI, any program evaluation in the real world healthcare setting. This is an opportunity when people see, when they see research and evaluation track on the schedule, they know that they are going to get something out of this talk. They know that they're going to learn about how to conduct rigorous research, how to effectively conduct a QI, a program eval in their healthcare setting. Sorry, my kids are in the background. So you might have just heard what's going on in the video game. You will be, the focus is going to be on providing attendees with some practical knowledge and skills. And I think there will be some example abstracts that really highlight how you can write about that. This is really, the research and evaluation track is real, think about it more as a how-to. How can I become an effective researcher? How can I teach others to be an effective researcher in the healthcare setting versus these are just my results? That's great. We want results, but we also want to be able to teach people how to go about conducting this research in their healthcare settings. You want to be able to teach people about how you go about approaching data collection. How do you analyze data collection, the data? How do you interpret what you're coming up with? So there should be some very clear takeaways for your audience members, whether that's knowledge, whether that's information on methodology, on skills that they can use to obtain their data. Ideally, after one of these presentations, you want your audience members to say, oh, okay, I have this thing going on in my site. I think I can do something similar to this and try to figure out how to build this program in my clinic, for instance. And I'm gonna use this approach that they used. So you want them to be able to come out with some of that information, because that will allow us, I mean, if we're looking at the grand scheme of things, it does allow us to really promote integration as well.
And just to follow up, to add a little bit to that, sometimes people get confused. So if you want to just tell the people about your results of your project, in the sense that maybe you did a quality improvement project and on your program, and you want to share those results, that would best fit in the general call for abstracts, not the research and evaluation track abstracts. The research and evaluation track abstracts have to talk about the how. So if you don't want to describe how you went about designing your quality improvement project, and you don't want to talk, or you don't want to talk about how you picked out your measures, or you don't want to talk about how you got your stakeholders involved, or you don't want to talk about how you interpreted the results, in those situations, if you're not going to tell us how to do something and give us a skill, then it belongs in the general call for abstracts versus the research and evaluation track abstracts. The research and evaluation track was created by the REC committee to really foster and increase and improve our skills in this arena. Many people go to graduate school and they may learn these skills in their training, but then that when they become clinicians or administrators, have put them down for many, many years. And all of a sudden are expected to do program evaluation or quality improvement or research, for that matter. And really, it's been a while. There's little cobwebs in the thing. So the idea of the research and evaluation track is really to try to remember and refresh, maybe update if things have changed, and give you some tools that you can apply, like Yajaira was saying, like into other projects. That should help differentiate the track.
And I just add a little more, I think, and maybe this is evident from what's been said, but it can be really, the stronger applications for this track oftentimes have some degree of audience involvement. There's something where you're working with the attendees, and in your abstract, you're being clear about how you're going to involve the attendees, you know, in what you're kind of teaching. So, you know, it can be helpful to think about this beyond just kind of a PowerPoint presentation, and more about, you know, how are you going to have folks practice maybe aspects of what you're trying to teach them.
All right. Let's do some examples, shall we? I think everybody benefits from seeing some examples. So hopefully we can, I'm realizing, is this blocking your view? Can you not see the top? That's unfortunate. Okay. I apologize that I can't make it.
We can see the abstract, the level.
Oh, you can't see my share. Okay, great.
Yeah.
Wonderful.
All right. Yeah, the first line is level up your skills.
Okay, great. So Jeff, do you want to go over this abstract and how it compares to what we've discussed already?
Do I want to go over this? Do I want to go over your abstract? So sure. So I think some of the things that we've alluded to is this idea of you want to create a little bit of a funnel. So you want to sort of start out kind of broad and narrow it down to ultimately what you looked at in your abstract. And so, getting beyond sort of the title and the authors, if we start looking at kind of the first few sentences here, what's being presented, is ultimately the problem, you know, the broader problem of kind of looking at sleep problems among adults. So this is a common problem, and that CBTI is an effective treatment for that, but may not be feasible in primary care. So you start out very broad, like this is a big problem for many folks. We have a potentially effective intervention, but that effective intervention may not be good for primary care. So you're drawing the reader in to an understanding of exactly why this is a problem, but also why it might be relevant, particularly for those individuals who are coming to CFHA. And so they go on to kind of talk about a little bit about what they did here, about the development of the brief CBTI that's being adapted for ultimately primary care settings. And so in this presentation, they're talking about ultimately what this treatment's going to look like, ultimately talking about the techniques that are used in this. They're going to discuss barriers about this, and ultimately they talk about their goal is to kind of increase awareness and knowledge. And so you have a sense that in this presentation that you're going to walk away with a much better understanding of what brief CBTI is, have a sense of how it's applied, and really be able to describe kind of those elements, and maybe even be able to think about, if you're working in a primary care environment, how you might apply it to yourself. And so you get a sense, you get really excited about this because you know, maybe you've seen sleep problems in your practice, and you know, if you're not familiar with this type of intervention, that you're going to have some, at least the knowledge and the exposure to like what ultimately this would look like to implement in your practice. And so you're absolutely going to want to focus on coming to this presentation as a must.
Which is already over, so you can't, but that's all good. Quick
No,
question though, for people in the group, would this be appropriate for the research and evaluation track, or would it be appropriate for the general call for abstracts? How about raise your hand if you think it belongs in the general call for abstracts? Figure out where it is on your little Zoom experience and see if you can raise your hand if you think it's general call. Don't raise your hand if you think it's R&E. Thumbs up. That's good too. Raise your hand or thumbs up. All right, so I'm looking, and it looks like some people have voted. Some people have not raised their hand, so I'm assuming. So it's interesting. So this is a how-to skill, but is it a how-to skill that's relevant to program evaluation, quality improvement, or research? No. So it is not appropriate for the research and evaluation track. This is actually perfect. And anything like this, where you are sharing some clinical innovation that maybe you developed or colleagues of yours developed, or somebody else developed and you adapted it like we did, you can absolutely share it, but it would be more appropriate for the general call for abstracts. This in particular is the how-to of research and evaluation track is specific to the how-to relevant to conducting quality improvement, program evaluation, or research. And that has the most to do with the fact that the cobwebs have really likely developed in that general area. That's where the how-to, you know, why we created that track is because it is so often an area that people would like to refresh and update and are asked to do at a more regular basis these days. Okay, let's do another one. All right, I'll do this one. So here's another example of abstract. And I apologize, you're getting a lot of abstracts that either I submitted or that people within this group submitted or were involved in, just because we needed examples, and that's where we got them. So this one in particular, again, it's trying to state the problem of trying to stay up to date with evidence-based brief behavioral interventions that embedded behavioral health providers can do. So it states the problem. It states why it's important to the audience, in the sense that we'd like people to be practicing evidence-based practices. And then it goes through the data. And so this one gives you a little different picture of when we were describing how to be specific. This is very specific, with telling you that 737 people were part of this pilot study, and it gives very specific information related to the reductions that the people found in doing the evaluation. And so it gives you very clear understanding of what data would be presented during the presentation. All right, I might do one more step, before we move on to questions and answers. Step 6 is you want to read the draft of the abstract and think about the criteria for review. So if you have children right now of any type, they always talk about the rubrics, because rubrics are the new teaching method of making sure that people know what they're doing as far as how it's scored and whether they're going to get all the points or not. It's the same kind of thing. Check out how the criteria, what is the criteria for review for that organization, for the abstract. They give it to you in the call for abstracts. In our case, the CFHA criteria, one of the pieces is importance. So whether it's consistent with the mission of CFHA, whether it addresses the theme that our lovely co-chairs have already talked a lot about, and with us hitting our 30 years of integration and kind of highlighting that, and whether it will draw interest. One of the things that's helpful to know is our audience. CFHA, if you're new to the organization, it's an interprofessional mix. And so you have, just like you do on this call, you have psychologists, social workers, family, marriage, and therapists, physicians, nurse practitioners, nurses. It's actually one of the most interdisciplinary conferences that I actually go to. So understanding that that's going to be your audience is helpful. The mission of kind of, CFHA and the special populations is also good to kind of pay attention to. If your innovation or abstract has to do with that, that would add to the importance, because a lot of patient populations are ignored. And it's helpful to have information about them presented at a conference to help push us a little bit, challenge us a little bit as an audience. I'm just going through quickly because I recognize the time and I want to give questions and answers. Jeff, speak up if you want to kind of share anything about any of these. Innovation and originality is another criteria in the review process. So whether the description in the abstract is talking about something that's innovative, unique, or timely. Clarissa gave lots of cool examples of lots of topics that I would fall right into this category. So contemplate any of those if you have anything on those. And just some helpful, advice is that CFHA has a diverse audience. So make sure you think about like that diversity and think about kind of where they're practicing, how they're practicing, when you're thinking about the abstract and making it either very specific to one group in the audience or broadening it out and making sure you're addressing the entire group. Another criteria is clarity and organization. It's really important that the abstract is well written and well organized so that people can understand it. And so if you find that you're struggling to read your abstract and understand it, or if you gave it to a colleague and they're struggling, it's really helpful to just take a minute and think about ways to improve the clarity of it. Because you need, again, I can't remember who said, you look in the app when you're going to the conference and you have only a few minutes to read a portion of the abstract to figure out if you're going to go to that presentation or the 5 others that are going on at the same time. So you want to make sure it's clear, because not only for the reviewers would it help, but it's also going to be really helpful when you're competing against the other presentations during that time slot. All right. I want to make sure that we have time for questions. So I'm just going to very quickly show an example of the research and evaluation track so that you have an understanding of what we mean by teaching. And so actually, I think I have another abstract here. So this was one that was for the research and evaluation track. And you will notice that when at the end you talk, when this abstract communicates that they will demonstrate how to assess the pragmatism of a trial using the 9 domains of the PRECISE tool. That is an example of a how-to skill that is relevant to research, program evaluation, or quality improvement. And that's what makes it fit in this track. All of these sessions are oral presentations typically, and they're all usually given either 30 or 60 minutes. So it gives you time to do the how-to because that's what people are coming to that track for. So in honor of tidbits of success, I'm going to open up to the group for questions because I think we've given a lot of those tidbits, and I would like to make sure that we have time to ensure that everybody has a chance to ask questions. And we have about 15 minutes, so I think it should be able to give everybody some time to ask them. So if you have a question, turn off your mic or turn off mute, and please feel free to ask us. But hopefully this gives some beginnings. And if you don't have any questions, we can go back to tidbits and see about other things.
I noticed that on one of yours, you mentioned that you can submit a proposal for something that's not finished, which is what I did. We're just at the beginning of a 6-month demonstration project, so it will be done, but we're still doing it. So what's the best way to present the abstract when it's a work in progress?
That is such a good point. And I'm so glad you asked that question, Tara, because there are organizations that are not so open to things in progress. So I'm glad you mentioned it. CFHA is, and they're very interested in innovation. And so they're very open to the things that may be kind of midway through. I think for me at least, and I'll let the others comment too, for me, when I've been a reviewer, the part that I'm really interested in, like in the abstract for those that are in progress, is some signs that it's actually started. Because although people want to believe optimistically that it might start in May or June, I like to know that some has already been collected, or if you're collecting data, or if you're doing something like you're getting qualitative interviews. The reason I say that is that there are bajillion barriers that can come up and make a project not go forward. So communicating in some way that it has started, this many people have already completed it or been involved in it, and it is hypothesized that this many people will be there by the time October comes around. So that's for me an element that I look for as a reviewer.
I think also, one of the things that can be useful, and I realize this is not always the case, but even offering some preliminary stuff can be very useful, just to say, this is what we have going on. And I think whenever I've reviewed, that always feels like it's a little bit more along the way than when it's not. So when possible, I think prelim data help.
I think also mostly for general sessions, but it's surprising how many people just put like a couple of quick sentences, like almost a teaser about what the session will be about. And I think that makes it very difficult for the reviewers to get a good idea if it's going to be a good session, because we do offer well over 100 sessions, but it's surprising how many, even good presenters, like people who've come year after year, we know they present well, people like their sessions, but then they'll just send like 2 or 3 sentences that are just very vague, and they get a really poor review. So just make sure you're putting that information into the description and/or abstract.
And again, just building on what folks have said, I think you know, particularly if you're doing something innovative, like even if you don't have the data, like sharing like what people will walk away from, you know, whether it's a presentation or a poster in the sense of, you know, we're going to describe kind of, you know, the elements of this, you know, of this innovative project and how we are implementing it in this particular innovative way. Like, so that even if you have no data, you know, at the, you know, when it comes time to presenting, like, I feel like there's something of value that folks will kind of, you know, be able to pull away from this. Because I think, you know, part of, right, I think part of what CFHA does a really great job of is highlighting sort of innovation and giving it a space for it to be presented. And so, you know, if you're doing something new and novel, like share that and you know, and highlight that as part of the abstract, so that as a reviewer, I'm like, oh, I want to hear about that, even if they don't have any data.
Well, that actually would lead to a good question for me, because I actually don't know where it would live, poster versus oral presentation. I emailed Neftali being like, you know, longtime listener, first time caller, what do you think about this idea? So super quick, we ran a nutrition, like a produce prescription pilot program where we actually gave our patients, we paid for our patients to have 16 weeks of fresh fruits and vegetables delivered to their home. And so far, the physical health data, which I was able to see, is pretty remarkable. I'm still waiting for like health behavior data to say like how people may have changed their day-to-day choices and things like that. We're working with Penn to get like an MPH student capstone. So that part of the research I don't have. It feels innovative. I guess sort of what I don't really know is what it feels like is like, here's this information. I'd like to share this because it's compelling. It's not necessarily a roadmap. So I just sort of don't really quite know the place that it might live. I wonder, does anybody ever have like on-call, like does any of the research and evaluation committee have like doctor's hours to like ever like spitball for people who are just dipping their toe in these waters and don't really know where they should be focusing their efforts and energy? I know I have something good. I just kind of don't really know exactly where it wants to live in terms of like something as major as the conference.
Yeah, well, one, I'm glad you came here. That's partly why we do this. Is I think any opportunity like this is a good one. You can always email either me or the other co-chair, Christina, and we'll get easy access to us. And our emails are on the Research and Evaluation Committee website. But I think you're bringing up a good thing that maybe I'll bring to the leadership panel of what we could possibly do. To answer your question, so related to oral or poster and how do you make your choice? So you have, you know, evaluation data. And actually, you could do an oral presentation that's more general, just sharing, or you could do a research and evaluation track presentation, like how you went about collecting the data, to be honest. And it's really, you know, what you have most interest in. So to me, I would be like, well, do you like to teach people stuff? Because did you find it hard to figure out how to collect that data or to figure out what the measures are? Because if you did, most likely everybody else will. And why not share what you learned? Because you probably learned some stuff along the way. And that's a great research and evaluation track submission. It's like, that's the idea of it. But if you would rather just share the results of like, hey, this is the cool program that we thought was innovative and cool to try, and here's the data that we do have around that program, then a general abstract makes sense. And I would always, if you're comfortable presenting in front of a crowd and interested in challenging yourself to do that, I would always go for an oral presentation first. Why not? You get more interaction and a longer period of time. And for me, it's a great professional development. It's scary the first time, but if you need a little pep talk or whatever, I mean, the rec is always there to give advice or a quick, you know, here's what you need to know about doing an oral presentation at a conference. And then if you're really hesitant and you're really cautious, then a poster might be a better option. but that's my thought. Jeff's a teacher enough, and I can tell he's ready to give you his thought.
Well, I mean, slap me down, Jen, with this idea, but I mean, you could actually do 2 submissions out of what you're describing. I mean, I find myself being really curious about how did you do this, this community engagement and like getting folks like, doing this nutritional intervention, like that would be really interesting, I think, for the RAC to kind of hear about, like, what was your process? How did you do that? What were the steps? How did you decide what you were going to measure? And, you would really describe that process. And then you could do a whole separate submission about the data that, and what you're finding and things like that. And you could present a little bit during the rec piece, but, you could have a whole separate submission that is about, what you're finding and all that stuff, which is less about the how-to and more about kind of what you did. And I can be corrected on that if you want, but I that would not be a bad idea, I think, in my idea, because I think they serve 2 very different functions, and could be valuable.
And Hillary, you can do, he's correct. You can do 2 submissions, or you could do the or. So you could do the oral or a poster. And if you aren't selected, even if you just pick oral, if you aren't selected, we do give people the option, like, would you prefer to do it as a poster? The discussion groups are more like a over lunch kind of conversation about a topic, but that's another option. There's 60-minute options, and there's also 30-minute options for oral presentations. So if you're not comfortable, you could do it a 30. You just have to cram more material in at that. But there's a lot of different options, but I wouldn't be afraid to try it. So.
I appreciate the uplift, everyone. This is just encouraging because the project was so special and important. And to your point about the research part, it was like really wrangling cats in a bag. So understanding the challenges of really trying to keep a program running from start to finish, really, it was not for the faint of heart. So I appreciate even thinking about it, just the process of running this pilot at like higher level overview than just what we did in the pilot. So that's kind of cool too, to think about that as well. And I think I might actually just try to submit both and see what has teeth.
Yeah.
Cool.
Well, that's the benefit of it, right? So.
And you can tweak presentations after they're submitted. Like, we don't submit anything for the continuing education till August. So tweaks can definitely happen. Major changes shouldn't. And then, title changes or adding a presenter, that kind of thing we can do along the way. So
when do we usually know if we're selected or not in terms of time frame between like selection and then like really doing the hard work of making sure we're doing a good job?
Oh, I let you know in May.
Okay.
Yeah. So when it isn't necessarily scheduled for a certain day of the conference yet, but I'll let you know if you have a spot. It takes a little while to kind of put in all the pieces into the schedule, but the reviewers review from April 1st to like April 15th or something like that, and then I work everything. There's 3 reviewers who review each proposal and score the submissions. And then we also have each of our special interest groups or the REC review also, because they kind of know the topic. And then our executive director and the people who do integrated behavioral health within our organization also review the sessions to make sure they're, we're kind of hitting all the different things we want to hit. So we could have 10 great presentations on one topic, but we have to make sure we have a variety of topics. And then I'll meet with the planning committee, the co-chairs, the end of April, and we do a lot of offline work before that, and then we have like kind of a online, or Zoom meeting to just kind of make any last decisions, and then I can start sending things out. I would say usually it's by mid-May, but I'm going to be away for 10 days in mid-May. So I'm telling people late May, just in case I can't do it in early May.
Thank you.
You're welcome. And if you have other just like form questions, submission questions like that, you can always reach out to me also.
Thanks so much, everybody.
So I'm recognizing the time, and I know people may have patients or other things that start right on the hour. So if you do have follow-up questions, I know the Jeff and I are easily accepting emails. If you'd like, feel free to reach out. I'm sure the planning co-chairs also are open to that, although they are very busy, and I don't want to overtask them since they're very much in the thick of the weeds of getting this conference together. But you know, if you do have questions, we'd be happy to answer them. And thank you so much for your time today. Hopefully this gave you a little bit of something to assist. And thanks to all of you for being willing to present with us. And you guys have a great day.
We have another meeting.
Thank you.
Astrid, there's more webinars coming. Yep. I will send you a schedule.
For this group. Meeting of this.
Yes, I will send you a schedule. Yep. Mm-hmm.
Thank you.
Okay. Take care, everybody. Thanks, Jeff. Thanks, Clarissa. Yeah. Thank you, Maria. I appreciate it.